Did you know that there's a human vaccine for West Nile? Well, most people don't. It's been sitting around for years without funding. The Night Beat's Jason Puckett looks into why it's not available to the public and why one local family is determined to change that.
But let them know, Lord, Cody is not suffering, he's not hurting.
In 2016, Greg Lashman and his wife Lacey Hopkins laid their son's ashes on a bowl for one last ride.
We've never would have fathomed in a million years that we would have lost our child to a mosquito bite.
Cody was 13 when that bite delivered West Nile, a virus that crossed into his brain and took his life. In the nearly 2 years since Cody's death, his family has fought, hosting 2 memorials, raising thousands for research, and becoming experts in their own way.
He was transported to Dells, and he was tested for everything except West Nile.
Cody's grandmother, Rosalie, even spoke to a state board on infectious diseases.
When my son-in-law did get to the hospital, he is an equine vet tech, and he told the doctors that Cody was showing all the symptoms of West Nile.
I had simply asked if West Nile was a part of any of those panels, because I knew we had just had some cases here.
Greg and Rosalie sat down with us along with veterinary Dr. Brian Brandon. See, as the family has researched, their list of questions has grown.
We still do see some cases every year.
Dr. Brandon explained that in horses, West Nile shows similar symptoms, but unlike with humans,
we do have a vaccine.
It took less than 3 years for a horse vaccine to be developed and marketed. Cody's family asked the obvious. With 20 years of research on humans, why don't we have one? The answer? Well, it made them furious.
Really heartbreaking to see what families go through, what people go through.
In that meeting with officials, Dr. Christy Murray spoke up. She brought the family to visit her lab at Houston, where she told them an angering reality.
There are several vaccines, not just one, that have already made it through the clinical trials.
A government list of trials shows at least 8 West Nile vaccines, some as early as 2004.
There are actually several vaccines that have made it through phase 1, phase 2 clinical trials.
Oh, that makes me extremely, extremely angry.
To the family, this meant one thing.
My grandson didn't have to pass away.
A frustration Dr. Murray shares.
It's upsetting. It's really upsetting, knowing that there is a vaccine out there that works and could prevent it.
In 1999, Dr. Murray was on the CDC team that discovered West Nile in the U.S. As it spread initially, funding wasn't an issue.
A lot of funding that comes in the very beginning of the process, but then as time goes on, that funding dwindles away.
Now, nearly 20 years later,
it just doesn't get the attention that it needs still.
There are reasons. Since '99, the CDC have only logged about 46,000 cases. Only 2017 were fatal. And West Nile is often thought of as only dangerous to the elderly with previous conditions. Why would pharmaceutical companies fund the final stages of research for that? Well, Dr. Murray argues that our numbers are wrong.
Only 30% who come in with clinical signs of disease actually getting tested for West Nile.
Like Cody's case, human tests aren't required even during mosquito season, meaning real numbers could be higher, something Murray believes won't change without families like this.
If you have people who take their tragedy and put it into something that's going to potentially make a change, that's what's going to need to happen.
We can't change everything. There's still going to be a lot of nasty, dirty things on this planet. This is one thing we can change. There's a vaccine sitting in a refrigerator. It's waiting to go.
Like a 13-year-old facing down a 2,000-pound bull, Cody's family and community are taking on a monumental task. Convince the medical community and pharmaceutical companies that this deserves funding.
Cody's favorite song was "One Man Can Change the World." He's not here to do that, but we are. We can do that for him.
And they're already taking steps. Rosalie is speaking again with the state soon at a special meeting for West Nile only, and they're connecting with families and politicians across the country to keep the memories of Cody and West Nile alive. For now, here in the studio, I'm Jason Puckett, KVUE News Night Beat.